Abdominal Aortic Aneurysm Repair by Anthony Hernandez and John Jansen. So we have 4 words in this procedure we're going to break down. First, abdominal. We start with the combining form abdomen-o, meaning abdomen, and the suffix al, meaning pertaining to or pertaining to the abdomen. We have aort/o combining form, meaning aorta, and the suffix ik, meaning pertaining to or pertaining to the aorta. And then aneurysm is not built from word parts, but comes from the Greek term aneurysma, meaning a widening. And then repair is a common term used in English with no known origin. So with all of this broken down, this surgical procedure is a repair pertaining to an aneurysm found in the abdominal aorta. Some facts about this procedure is it comes with a 5 to 6% mortality rate and a 21% readmission rate within 6 months of the procedure being performed. The average cost to get this procedure is roughly $40,000. And a fun fact about this procedure is that smoking can increase the risk of getting a AAA or an abdominal aortic aneurysm by up to 8 times, increasing your risk of needing this procedure. And on this slide, again, section 1, there is a graphic of the procedure being done, which is the open surgery version.
The procedure process. The surgery is done in a hospital operating room or a hybrid operating room. What is done in the procedure is typically an open surgical repair, OSR, or an endovascular aneurysm repair, EVAR. It is done to prevent rupture, which could cause eternal bleeding leading to death, if not acted quickly. The recovery for OSR is usually 5 to 10 days in the hospital, and EVAR takes 1 to 3 days in the hospital as well. So the procedure team is the main surgeon who performs the procedure, which is called a vascular surgeon, cardiothoracic surgeon, which may assist the surgery if needed, anesthesiologist, surgical nurses, a scrub technician, radiologic technologist, critical care team, a cardiologist, and a radiologist, which all perform in the surgery.
All right, section 3. We are going to be translating this procedure or surgery into lay terms or everyday terms that most people would be able to understand, not having taken a medical terminology class or having any medical experience. So, the abdominal aorta is a large artery in your body that carries blood away from the heart. When this artery gets weakened due to the aneurysm taking place, which is a ballooning out of the artery, it requires surgery to fix before this aneurysm bursts. There are 2 options to get this surgery done. First being open surgery, and second being EVAR acronym. EVAR is where a small tube is inserted into the blood vessels of your leg and then placed all the way up inside the aneurysm, and it rests inside the bulge. Secondly, open surgery requires the belly to be opened up directly to repair the aorta. Which surgery being done depends on the results of an imaging scan, which will be done by your specialist when you are getting tested.
So the video I chose was by Mayo Clinic. Vascular surgeon explains abdominal aortic aneurysm screening treatment. So in the video, Dr. Peter Glashwowski describes the benefits and risks of the procedure. He mentions how people who are older, mainly men, but also women, who have past smoker history should be screened for AAA screening since they have a higher risk of rupture. They are also diagnosed with ultrasound and CT scans. They also monitor small asymptomatic aneurysm, and treatment in the procedure will be done with an approach of OSR or EVAR for bigger asymptomatic aneurysms. So the benefits that the doctor describes of the procedure and process is to detect it early on before it worsens to prevent rupture, so the patient doesn't have to act fast if it were to rupture. So this repair benefits the patient because it also has a mortality rate that went down from 4.6 to 2.8%, which shows how beneficial it is for patients who experience this, which helps them survive and live longer lives.
All right, section 5, we have a fictional case study on an abdominal aortic aneurysm repair utilizing medical terminology terms from our textbook. So, John Jansen is a 70-year-old male who checks into the emergency department complaining of abdominal pain that radiates to his back. Mr. Jansen has a long history of hypertension and smoking. He had an ultrasound done, which revealed a AAA or abdominal aortic aneurysm. Due to the unusual size of this bulge in the aorta, John's doctor said there would be a great risk of rupture or arexis. The doctor also made sure to note that there are no signs of active hemorrhage from the aneurysm. To prepare for the procedure, John was starting to take IV fluid and beta blockers to get his body ready for the surgery. The surgery was a success, and John was released from the emergency department later that week.
Section 6, the case study vocabulary from our previous slide, section 6. So the first word is abdominal. It is a word part verb. Abdomen, meaning abdomen, and then al, pertaining to. So the definition is pertaining to the abdomen. Hypertension is the next word. It is also a word part word. Hyper, meaning excessive and above normal. Tense, meaning pressure and tension, and then ion is the process and condition. The definition overall is a condition where blood pressure in the arteries is above normal levels. Our third word is ultrasound. It is also a word. Ultra meaning beyond, sound meaning sound waves. The meaning diagnostic imaging technique that has high frequency sound waves to visualize the internal body, such as organs, etc. Aortic meaning aorta. Ic meaning pertaining to. It is not built from word parts, but it is pertaining to the aortic aneurysm. It comes from Greek origin and refers to a localized enlargement of an artery. Rectus is a word, but it is only a suffix word. Rehectus is the rupture of an organ or a structure. Hemorrhage is also a word part word. Hem is blood, ridge is bursting forth, and it is meaning uncontrolled bleeding externally or internally. And then our other word is IV fluid. It is not a word part word. It comes from Latin intravenous venomous. It is a liquid that is plugged into our vein for hydration. Our final word is beta blockers, which is not a word part word. The origin function of blocking beta adrenergic receptors in the heart, meaning medication that reduces blood pressure and heart rate by blocking adrenaline.
And section 7, a critical thinking question to anyone who is watching this so that they can answer in their discussion post. The question reads, what are some tests that can be done to find out whether or not this surgery procedure is indicated? Somebody needs open surgery or EVAR, or in other words, which one of these two is better for the patient, and how do they know that?
So finally, section 8 is our APA citing section. These are all the sources we use throughout the video to gather our information, the video that we use, the case study, etc. You can go back and pause to get the bigger link of the YouTube video if needed. But overall, these are all the sources that we use and cited. Thanks for watching. Our presentation by myself, Anthony Hernandez, and John Jansen.